everyone, I'm Dr. Karski and I am going to present to you a dental health lecture. All right, so first and foremost, I'm an orthodontist, but I'm also a dentist and I'm also a mom. So I just wanted to show you, these are my kiddos. There's a few photos of them throughout the presentation because a lot of what I'm going to talk to, they've also experienced as well. This is Dr. Spokane and myself. In our practice, we have two doctors. We have a lot of fun together. Again, there will be a lot of photographs kind of showing the office and what it's like to visit with orthodontists. All right, so there are 2 months out of the year that we talk about teeth. One, of course, is in February, which is National Dental Health Month. And another month is National Orthodontic Health Month, which is in October. So you may have either us or other orthodontists coming in October that can talk to you about braces, expanders, all of that sort of thing as well. Now, like I said, first and foremost, I'm a dentist. We're going to kind of divide the lecture up a little bit. I'll talk about orthodontics in the beginning, and then we are going to talk about dental health in general and taking care of our teeth. So, at what age should we see an orthodontist? Well, the average age that we like to see an orthodontist is about the age of 7. The reason we like to see you at 7 is not so much for the perfect straight teeth, but more so because we'd like to make sure that your bite is healthy. And 7 is a good age to do this. We like to make sure that your upper and lower jaws are fitting together properly and that you can chew properly and all of those sorts of things. So that's a good age for us generally to see you in the orthodontist office. Does that mean you need braces at 7? Not necessarily, but it's a good time for us to check you out and just make sure. So 7 is the magic number. See an orthodontist by age 7. Now, these are some of these photos are a little bit yucky, I know, but I'm going to kind of go through with you basically some of the things that we're looking for to see if we need to fix them. And 7 is a good age to take care of some of these things. Now, the first one is called a crossbite, where you see this one tooth is kind of pushed forward a little bit. That is something we do like to take care of sooner than later. Something called a crossbite in the back, where the upper jaw is narrower than the lower jaw. Crowding, where there's not enough room for your teeth. An open bite, which we'll talk a lot about later on, but basically the upper and lower teeth can't come together, as you can see here, which makes it very difficult to chew your food or to bite into a sandwich, things like that. Protrusion, or when the upper teeth are too far forward, that's something we do like to correct, and we'll talk about that as well. A deep bite, when the lower teeth are actually hitting the roof of your mouth, that can cause trauma to your mouth. An underbite, when the lower jaw is too far forward. Spacing, when there's too much space between your teeth. Something we can fix later on, but it's definitely something we like to look for. And then, of course, habits. So we are going to talk about habits first. So, a few habits that we are going to talk about. The first one is sucking our thumb. So sucking our thumb is actually a habit that many of us had when we were babies. Sucking your thumb is very calming. Sometimes we even suck on our toes. This is just a funny picture. But binkies or pacifiers are another thing or another type of habit that we might have had when we were little, but it can affect your teeth. So sucking your thumbs were fun and they felt really good when we were little. But as we grow older, it is a habit that we like to stop. But sometimes we need help stopping the habit. So that's where we as orthodontists come into play. But again, sucking your thumb when you're little, it can help put babies to sleep. And as it becomes a habit, sometimes as we grow older, we still use our thumb to put us to sleep. Even in mommy's belly, we sometimes suck our thumbs. So as you can see, it's a natural thing, okay? This baby here sucks 2 fingers. Sometimes it's a habit where it involves other fingers, not necessarily the thumb. This is my son. This is Beckham. He sucks his thumb still. So of course, at some point, I'm going to have to help him as well. Again, eventually this is a habit that we do want to break, and I'll talk about a few of the reasons and how this affects our teeth and why it's a habit that we want to break. So thumb sucking. Basically what happens when you suck your thumb is the pressure from your thumb on the roof of your mouth can actually make the upper jaw narrower. It kind of caves in a little bit. So that can lead to things like the crossbite I showed you, or an open bite like you see right here, where the upper and lower teeth can't come together. The issue with that, again, is if you were to bite into a sandwich, you really can't chew your food properly. Okay, so it can definitely affect the way your teeth are coming together. This boy here, he's around 12 years old. He still sucks his thumb, but he can't help it. It's a habit he can't break himself. So him sucking his thumb actually pushed his teeth forward here. You can see on his side x-ray that the teeth are flared forward a little bit. This is showing you, again, someone else, but notice the open bite and how the tongue or the fingers basically push the teeth apart so that they don't fit together properly. But there's that boy again, and these pictures are showing you what his teeth actually look like in his mouth. Just over time, it pushed the teeth apart. Now, the next picture, this obviously isn't that boy, but it's showing you what could happen if you suck your thumb too long and cause your upper teeth to kind of flare out a little bit. Because if your teeth are flared out a little bit and you were to fall down or get elbowed, kind of like you see here, it can cause trauma to your teeth. So bear with me, it's a little gross, but those are actually some broken teeth there, and that's from getting elbowed, and it actually broke off some of the teeth. So it is important, that's the same picture from the side view, it is important that we bring those teeth back to where they're supposed to be so that they don't become a risk. Now, orthodontists can prevent this from ever happening, or once the problems have occurred, like the narrow upper jaw or the teeth flaring, we can fix the problem as well. So not only can we help to break the habit, but we can also fix the problems that it might have caused. So there is a certain kind of appliance that we typically use as orthodontists to fix the habit as well as the problems, and that is an expander. Now, there's many types of expanders out there. We prefer an acrylic type of expander. Of course, you can design them, but more importantly, those little wires you see at the top there, those go in an expander if you have a thumb sucking habit or a finger sucking habit, because those wires, believe it or not, they don't hurt, but your fingers and thumb don't like them. So usually once it's in your mouth for a few days or weeks, the habit is completely gone. Once the habit's gone, then we can remove those wires. So this is just showing you a couple different expanders. Of course, you can make it custom, but it's just showing you what it looks like in the mouth. A couple more examples there for you. There's someone that chose SV as their sticker. And in our office, we celebrate when you stop sucking your thumb because we think it's a great accomplishment and something worth celebrating. So what we do is we take a little plaster mold of your thumb or your fingers, and then we give it to you to take home with you, and you can put it on your dresser as a souvenir. We also can give you nail polish that you can put on your plaster model of your thumb or finger. Just something fun that we do. These little kids here are celebrating that they stopped sucking their thumb. Okay, so the next thing we are going to talk about is the tongue, because there's another couple of habits that you can do that involves your tongue. Tongues are very important. We use them for laughing, talking, yelling, kissing puppies, all that good stuff. So they're very important, but they also can cause problems. So you see this little boy here, he has what's called a tongue thrust. So he constantly has his tongue out in between his teeth. Why is this a problem? Well, same thing with the finger habit. If the tongue is constantly pushed forward between the teeth, it can affect how your teeth fit together. So that's a habit. It's hard to break, but it is something that we like to break. This person here obviously uses it more when they're concentrating. So there's different times of the day that this might occur. But notice here how those teeth are not coming together the way that they're supposed to. And this is how they actually bite. So the teeth in the back are touching, but not in the front. So it's similar to that open bite we talked about before. Notice the tongue here, it has little scalloped edges. That's from the tongue constantly being between the teeth. So it causes a little bit of trauma to the tongue sometimes as well. And if you notice the teeth not coming together in the back, that's an open bite in the very back of the teeth. Again, from the way that their tongue has been sitting in between the teeth as a habit. This is not necessarily a habit, but I wanted to bring this up. You might have heard of a tongue tie before. So this is something that can involve the tongue that you might have heard of. And sometimes you have to have that little tongue tie snip to help with speech. So open bites that we talked about from the habits sometimes can affect actually how you talk, which is why it's important. So S, T, and Z sounds can often be affected by an open bite. And sometimes you have to have some type of speech therapy to help with this as well. So a lot of times we coordinate our treatment with speech therapy in order to get the teeth to fit together so that, again, you can speak properly. This is my daughter. So she has a tongue thrust. She always slept like this with her tongue between her teeth. It started to cause her teeth to not fit together, and she actually developed an underbite from her problem. So it's a habit that we have fixed, actually. This is another habit I'm sure many of you have experienced. And there is something that we can recommend for this. This is, of course, licking your lips, right? Just like this little puppy here. Licking the lips can cause chapped lips, sores, that sort of thing. And of course, chapstick is what we recommend for this. So fun little picture there. Now, there is another type of habit that can affect your teeth, and that's nail biting. So many of you have probably heard your parents or teachers say, stop biting your nails, it's dirty, which it is, but also it can affect your teeth. So notice here how the gums come down really low on this one tooth. That's because they constantly were biting their nails in that one area, and it can actually cause what's called gum recession. So that is a habit we want to break for that reason too. Now we'll kind of switch gears and we'll talk a little bit about what to expect at an orthodontist office. Now there's many orthodontists. Most offices all offices are very fun to visit. I'm just going to show you what to expect though. Typically you'll get an x-ray. It just spins around you. This is a panoramic x-ray. And what this does, first of all, you just kind of stand there. Nothing hurts at all. But what this does is it gives us a view of all of your teeth. So it shows us your bones, it shows us your baby teeth, your permanent teeth, your joints, your wisdom teeth, just to make sure that everything is coming in healthy. It also can show us, again, if there's enough room for all of your teeth or if you have any extra or missing teeth. We also take what's called a cephalometric x-ray, where you get these little kind of rods that just kind of rest on your ears. Again, it does not hurt, but it gives us an x-ray view. This is just a funny picture, but it gives us a nice side view so that we can look at your bones. Because again, as orthodontists, we're looking at teeth, but most important at your age, we're looking at your bones. We want to make sure your upper and lower jaws are sitting where they're supposed to be and that everything is functional. So as orthodontists, sometimes we measure your x-rays and just make sure everything is where it needs to be. So we have lots of fun in the office. I just have a few fun photographs showing the team. Now this is something called an impression. Now some of you may have had this before. They don't always taste great. It's like a goopy material that goes in your mouth. And when you have an impression, you take it out and you can pour your teeth up in plaster, which is pretty cool. But not everyone loved impressions. They, like I said, didn't taste good. They didn't feel the best in your mouth. So we have a new appliance, which is called a scanner. And some of you or many of you have probably had this before. But basically what it is a wand that goes over your teeth. It's basically a little video camera. And as you scan with this little video camera, the teeth show up on the screen. And then after we do that, this is just showing you an example of how easy it is. And that's even my little girl. She was only 3, and that's how easy it was. She was getting scanned at 3. But we can actually print, using our scanner, we can then print your models in 3D models, which is really neat. So you've probably heard of the 3D printer before. We use it all of the time in dentistry and specifically orthodontics now. So there's a picture of the 3D printed models, which is pretty cool. And usually you get to take those home with you also. And this young lady here is showing us an image or an example of her 3D printed model with her expander on there, which is pretty neat. Another thing we do in our office is take photographs. We usually have a nice camera here where we take pictures of your teeth, and sometimes we use these little cheek retractors that pull your cheeks apart a little bit so that we can get nice pictures of your teeth. And again, lots of fun office pictures. We like to do a lot for the community, and like I said, we just like to have a good time in the office. Now, as an orthodontist, when you come in, we have to decide, okay, do we need to do anything at all? Maybe not. Maybe everything looks great. Maybe you need an expander. Maybe you need braces. Maybe you need retainers. So that's our job to determine that. All right, a couple more fun pictures here. So the next thing I'm going to talk about is braces. So of course, when you think of us, this is probably the first thing you think of. So we'll touch base a little bit on braces and what exactly they're made of and how they work. So this is actually my daughter getting braces, but this little red thing here, if any of you have had braces before, typically you have something in your mouth like this that basically makes it dry, makes your mouth nice and dry so that all of your braces can stick better. So our goal is to keep everything really, really dry. And that's why we use this. It has like a little suction that's attached to it to take care of any extra saliva. We have these lights you've probably seen that basically just dry the glue. They don't hurt. But they make the glue dry. And then of course you have your braces. So braces are actually just these silver little squares that go on the individual teeth. And then we have a wire that connects the individual braces. The wire is actually what does all the work. And then these little colored ties are what holds the wire in place. And usually you get to change your colors every time you come in to see us, which is always fun. This is showing you a couple with colored ties. Sometimes we use these little silver metal ties. Those are also used to hold the wires in place also. These are just showing you a couple of the different color options and how sometimes you can get rainbows or basically whatever color you want depending on the holiday, which is fun. Same thing, just showing you some colored ties and some silver ties in there. And these are all the different wires. So there's all different sizes, shapes of wires. Depending on what point you are in your treatment, we put different wires in. This is called a chain. Basically what it does is it's all the colored ties connected, and if you have spaces between your teeth, it pulls those spaces together. Rubber bands, I'm sure many of you have had braces, have worn them. Rubber bands are super important to make your bite fit together. So if you ever have an underbite or an overbite or something that your bite basically isn't fitting together, the rubber bands are really important to make your bite fit together. And there's all different combinations of rubber bands that you can wear. That's just showing us putting the braces on. Now, the next thing is called a face brace. So a lot of you may actually have one of these and nobody even knows it, because usually you don't wear this out of your house. You usually wear it when you're sleeping, watching TV, basically just around the house. Most importantly, though, is when you're sleeping. And then a face brace is really important to fix a certain bite called an underbite. Okay, so notice how the lower jaw here is forward. Same thing, look how his lower jaw is getting pushed out. Again, that's my daughter. Notice how her little jaw is too far forward there. This guy here, 5 years old, and he has an underbite. So I know we said 7 was the magic age, but if you have an underbite, believe it or not, we can fix this a lot earlier. This is an underbite for more one tooth, but that tooth is getting pushed out, so it's something that we want to fix. This is showing you where we want your upper jaw to be, and this is showing you that the upper jaw is too far back. So our goal with our face brace is to actually pull the upper jaw forward. Nothing hurts, it's super slow, and right now your bones are really mobile up there, so it doesn't hurt you when we use our face brace. It's basically a pad here, and then these little rubber bands connect your face brace to an expander, and that's what pulls your jaw forward. This little girl here, this is where her upper jaw was a little far back, and then her upper teeth were sitting behind her lower teeth. So we had to fix it. This is showing you someone else wearing it. They even decorate their face brace and try to make it fun. This little guy here is putting it on himself. It's very easy to use. You can take them on and off yourself even without the help of your parents. It's very easy. This is showing you someone without or before we worked on him, and then afterwards. Notice the change of his upper jaw, how far forward it came. Just showing you all the little ones in the office that have had them and how easy it is. And that's showing you before, during, and after the usage of a face brace. More kiddos wearing them. And those are just the fun pictures of the little ones. Okay. And then finally, we're going to talk about widening the jaw. We touched base a little bit on expanders, but I'm going to talk a little bit more about them. This is, again, you saw this before, but just photos of expanders. This is showing you how crowded there was not enough room. Look at the number 3 at the top. There's really nowhere for those teeth to go. So we used an expander, and now the number 3s are able to drop down where they're supposed to. So it's basically showing you how an expander can make a lot more room so that we can fit all your permanent teeth in. This person here probably could have used an expander, and now there's nowhere for those teeth to go. So now we may have to consider removing permanent teeth. So we ideally can expand and make room for everything. This is showing you some of our stickers. You can, of course, design your expander, pick colors, stickers, make it glow in the dark, make it custom to you, which is always fun. This is showing you my little guy here who had an expander, but just picking the colors, someone else picking out their colors. And this is showing you after you're done turning. So it starts out real close, and as you turn a little key, the expander gets a little bit bigger, and it makes a lot more room. So just some more examples of the expanders, and they're all custom. Now this is showing you someone that's sleeping with their mouth open, or mouth breathing you might have heard of, or snoring, right? Sometimes we snore or we just we sleep with our mouth open because we don't have enough oxygen. And believe it or not, sometimes, not all the time, but sometimes if you use an expander to make the upper jaw a little bigger, you can actually open your airway up, which can really improve snoring and mouth breathing and that sort of thing as well. This little girl here is stuffy all the time, very congested. Again, making her palate a little larger can sometimes open your airway and help with allergies and stuffy noses and that sort of thing. Just a few more expanders here. We have lots of kiddos showing them off. All right, so this is someone here. He started real crowded, had an underbite, and then we fixed him up with an expander and a face brace. So it's a pretty cool final finish there. And this one's showing you in the mouth before and after turning it. And you can see how much room that expander gave us. Okay, retainers. A lot of you may have retainers. There's many types out there. We prefer the kind with the little metal bar, and that is acrylic or plastic when you have had an expander, because it can help hold the teeth after you've had an expander. And it looks something like this. Of course, you can make it your own. There are many types out there. And we give candy usually after we're all finished, because you couldn't have any during your braces treatment. That's just showing you us working. Now there's another kind of Invisalign, or I'm sorry, retainer called Invisalign. Invisalign is basically a clear plastic tray that holds the teeth in place, or it can be used in place of braces to move the teeth. Typically we use Invisalign when you have all your permanent teeth in. Sometimes though we do use it when you still have some baby teeth in there, but it looks something like this. And they're clear, basically clear braces that move the teeth. Okay. Again, just a few more images of how much fun we have and how easy it is to come to the orthodontist. Everyone's always smiling. All right, and we also have a tooth fairy jar. So if you lose a tooth in our office, we let you decorate a little tooth fairy jar, which is fun. All right, so we're gonna do a teeny little quiz here. It's more like a little game, but basically, this person here is 7, and they have a certain kind of bite, and there's a couple different bites actually. And basically, one of those would be a cross bite in the back, open bite in the front, and underbite in the front. And a certain kind of habit that might have caused this, sucking our thumb, maybe. And then there's a certain kind of appliance that we may use to fix that underbite, and that would be a face brace. So something that we would use to pull the jaw forward. So that's showing you after it was corrected. And there's the face brace. All right, and then the final part of our presentation, this is going to be about dental health and keeping our teeth clean. So, brushing our teeth. So it's most important that you brush not only your teeth, not only your gums, but the line where the teeth and the gums meet. This is a junction right here where the teeth and the gums come together. You always want to make sure your toothbrush is hitting this spot. And it's always important that your toothbrush comes in at an angle, because believe it or not, you can get in the grooves of that junction much better when your toothbrush is coming in at an angle, okay? So flossing, it is important that you floss at least once a day. Flossing is really important to get in between the teeth. Brushing can get on the outside, but flossing gets in between the teeth. When you floss, it's really important that when you go in between, you go up one side of the tooth and down, and then back up again on the adjacent tooth or the tooth next to it. So when you go straight up and down, that's great. It's good that you're doing it at all, but it's also really important that you go up both sides of the tooth. So you basically want to go up, down, up, and then move to the next tooth or the next contact point between teeth. So it looks something like that whenever you floss. This is called a water pick. Super great to have, but it does not take the place of traditional flossing. So it's great to use in addition to regular floss. They're fun, they can be a little messy, and they do a great job, but I wouldn't replace your regular floss with a floss water pick, but they're definitely great to have. This is a Christmas tree brush. We like to use this when you have braces. It's great to get between the wire and the teeth, like you can see here, to get out large pieces of food, but again, does not take the place of flossing. You definitely want to use this, but it's also important that you use regular floss. Now, something I want you to remember, the most important of this entire lecture are my two P's that I'm going to talk about first, which is pink and pointy, right? Pink and pointy. Remember this slide. Pink gums and pointy gums. Notice how nice and sharp those little points are. This looks very, very healthy. All right? This does not look pink and pointy. This would be my two R's, or red and rounded. We don't want red and rounded gums. Notice how round they are, and they're red. They do not look like that pretty pink and pointy slide that you see here. Now, red and rounded gums typically comes from this white stuff that you see there, okay? More close-up view, which is plaque. And I'm sure a lot of you have heard of plaque. Plaque is made of three different things. One, the food we eat. It can be any food for the most part. Any food can produce plaque, okay? Germs, or as we used to say, sugar bugs, so basically bacteria. There's bacteria in our plaque. And acid. So who would want acid sitting on our teeth too long, right? That's why it's so important that we brush and floss, because we want the plaque off of our teeth. Food, germs, and acid. All three of these are in plaque. This is showing you someone that might have had braces, and here was where the brace was, and they left the plaque sitting on the teeth too long. They let plaque sit there overnight or for days. And that plaque basically started to eat away at the teeth, which causes these white stains here. Okay, so people that didn't brush well might have stains on their teeth, and then those stains, of course, can turn into cavities. So it's really important that we get that plaque off of there. Nobody wants a cavity. Again, white spots that have turned into cavities over here. Now, fluoride. Fluoride is really important to remineralize our teeth. So sometimes if there's a cavity that's starting, fluoride can be reused to make the tooth a little bit stronger. Fluoride's in our drinking water, it's in our rinses, it's in our toothpaste. Sometimes you'll get something called fluoride varnish. Even the pediatricians are doing fluoride varnish. And then there's also something called sealant. So this molar here has these grooves. Some grooves are very deep, and we have to fill in those grooves to make sure that food does not get stuck in them. So sometimes dentists will put something called a sealant. They don't hurt. It's basically just a white type of glue that goes into the grooves, and it keeps it sealed and keeps food away or from going into the grooves. Dental health of our dogs. It's very important that we brush our dog's teeth. Just wanted to throw that out there. This is my little wiener dog, Kevin, and he also gets his teeth brushed regularly. 3 times a day. That's how often we recommend brushing your teeth. So morning, after school or lunch, and before bed. Those are oh so important that you make sure you get all that plaque off of your teeth. 2 minutes is about the time we recommend to brush. So whether you set a timer on mom's phone, mom or dad's phone, on the stove, take one of those little sand timers, whatever you can do, 2 minutes is the ideal amount of time. And that's because you have all of this surface area to cover. So when you're brushing, you want to make sure not only are you brushing that line I talked about where the gums and the teeth meet, you can see that there, this is showing you close up that line. You also want to brush behind the teeth. So where your tongue is, you always need to make sure your toothbrush gets in there. Same thing within the front, behind the teeth. And then, of course, the top surface of your teeth. So this is showing you the surfaces where you chew your food. You always want to make sure you get that really, really good. Your tongue, super important that you brush your tongue. Why? Prevents bad breath, actually. So if you brush your tongue regularly, there's a less chance of having bad breath, which is great. The amount of toothpaste we need on our toothbrush, very important. You actually don't need the whole strip. I know we always are shown that on commercials and in general, but you really only need like a pea-sized amount that you can see there. That's all you really need. And it's very important that you put the cap on after you're done for your parents' sake. And my kids leave it off all the time. Okay, see your dentist every 6 months. Most important for that is, will you get a good cleaning? They have nice tools in there that they can clean really good. Does not hurt, but it can get your teeth nice and clean. And also just to make sure that your teeth are healthy, that you don't have any cavities and that sort of thing. Okay, finally, just a couple nutrition items we're going to talk about. So we talk about what's called dental friendly. So we're just going to I'll show you a few food items. Dental friendly means, it doesn't mean you can eat or not eat a food. It just means if they're not so dental friendly, maybe you want to brush right afterwards to make sure that you get all of the plaque that it produced off of your teeth. So to begin with, I would consider this a dental-friendly food, avocado, right? It's a vegetable, hardly any sugar in it. It would be great for your teeth. If you didn't quite brush right away, that's probably okay. Bread. This is a little bit of a trick question. It's very healthy. It's probably whole grain. It's still great food. But sometimes bread can stick in your teeth a little bit longer. It can sit on your teeth longer than other foods. So that might be one after you're done eating lunch and you had some bread, go brush your teeth when you're finished. Oranges. Another trick question. It's a fruit. Super healthy. Very good for you. Lots of vitamin C. But oranges have a little bit of acid in them, a little bit of sugar. Wouldn't hurt to brush your teeth after you had some oranges. Eggs, super dental friendly, all protein, hardly any sugar. If you had some eggs and you didn't quite get to the toothbrush soon, that's okay. Very dental friendly. Ketchup, made of tomatoes, still good for you, but there's a lot of sugar in ketchup. So that's another one, probably want to brush soon after you've had ketchup. Almonds, very dental friendly. Protein, it's a nut, doesn't have a lot of sugar in them. So again, dental friendly. Orange juice, lots of sugar, lots of acid, similar to the oranges we talked about. So it's still great food, lots of vitamin C, great for you, but good to brush when you're done drinking this. Pretzels, great snack. Most of us love pretzels, but they can stick in your teeth a little bit longer. They kind of get in the grooves of your molars. Definitely good to brush your teeth after you've had pretzels. Skittles, not the most dental friendly. They stick in your teeth a lot. Chocolate, again, has lots of sugar, but believe it or not, if you were to pick between chocolate and Skittles, dental-wise, it's probably better to go for the chocolate because it actually sits on your teeth a lot less or a lot shorter of a time than the Skittles would. Steak, meat, any kind of cheese, very good for your teeth. Vegetable peppers, of course, also dental friendly. And goldfish, again, a great snack. We all love goldfish, but they do tend to stick in your teeth a little bit longer, something you want to brush when you're finished. And that's it. Thank you, everyone. I really appreciate your attention today.